Good evening, this is Bettina Arndt, and for the next 2 hours I'll be talking about sex and about sexual relationships. Specifically tonight we're looking at sexually transmitted diseases. Some of the topics we may be dealing with are rather explicit and may be offensive to some people. But in the studio tonight I have a doctor who specialises in sexually transmitted diseases. Good evening, Basil.
Good evening.
We're not giving you a full name because of medical ethics, of course. Which is a problem we always run into. And then I also have Terry Goulden. I knew I was going to get that wrong. Goulden, I've got it right, finally. Who is from the Gay Counselling Service. Is that right?
Yes, that's right.
Good evening, Terry.
Good evening.
And the reason I have two guests tonight is we're looking at AIDS. The Medical Journal of Australia this week has a rather alarming cover which shows a skull and a gory looking x-ray of some diseased looking lungs. I assume they're diseased looking lungs. And the title of the medical journal this week is The Black Plague of the 80s. AIDS, the Black Plague of the 80s. And it has a little slogan saying, perhaps we've needed a situation like this to show us what we should have known all along. Depravity kills. Basil, how do you react to that?
Not very well, I'm afraid, Tina. Unfortunately, the large print on the front of the journal was extracted from newspapers, and they've neglected to put it in quotation marks. I find the cover quite offensive and judgmental. I think we should first of all.
Well, we better tell people who don't know what AIDS is, and then we'll talk about how people should react to it.
Good enough. Yeah.
This isn't exactly how you think the medical journal should be promoting discussion of AIDS.
No, far from it.
I suppose we should be happy that they didn't say the gay plague of the 80s.
Oh, well, I'm sure someone else is saying that.
Yes, for sure.
But we'll talk about that. And that's the real point about AIDS, of course, is the link with the homosexual community and the way people are reacting to it, which is why Terry's with us tonight. It's bringing out all sorts of prejudices, I think, about homosexuality, and it's very much confusing the issue. But we'll get into that in a moment. All right, Basil, what are we talking about?
AIDS are initials short for Acquired Immunodeficiency Syndrome.
It's just obvious why they're calling it AIDS, isn't it?
The condition hardly even qualifies as being called a syndrome. At present, it's more just a phenomenon. And the phenomenon is a previously healthy young person. By definition, they have to be under the age of 60. And by definition, previously healthy with no particular medical treatment or other condition, causing a shutdown in a very vital part of their immune system. The result is, if the condition happens in the individual, the prognosis isn't very good.
So
they present either with a severe, what we call opportunistic infection, which is a germ that normally wouldn't invade or worry or cause only minimal discomfort to an otherwise healthy person because their own defense system would fight it off. In this case, that branch of the defences is no longer existent, and often that condition can go on and kill them.
So our immune system normally protects us from all sorts of bugs that are floating around.
There's all sorts of branches of it. It's a particular part of the immune system closes down.
Yes.
The current state of study is that they've found no particular agent that causes this phenomenon. Because of its behaviour, because it's spreading in a fairly rigid pattern, the assumption that is that it's an infectious disease. Now, again, that's just an assumption. There has been no trace of any particular virus or bacterium or other infectious agent associated with it. There's research on viruses that seem to run in parallel with it, but nothing that actually seems to particularly cause it.
But basically what we know is that something is going wrong with the immune system that causes people to not recover from illnesses they would otherwise recover from, to get illnesses in more severe form than they would normally, and in some cases it can be lethal.
Yeah, the phenomenon in retrospect first appears to, the earliest cases appear to have been in the United States about 1978. the total number of cases to date is about 1,300, and judging from the rate of notifications, which is up to about 5 or 6 new cases a day, they anticipate about 2,000 cases by the end of this year.
What about in Australia?
That's a controversial question. There is one virtually proven case of AIDS occurred in Australia, which was entirely imported from the United States, and that case has exported itself back to the United States. There are several other cases of what I call a very unfortunate term, which is suspected AIDS or prodromal AIDS, reported in the Medical Journal of Australia. Now, it's quite unproven that the phenomenon of a previously healthy homosexual man who develops large lymph nodes and a particular pattern on blood testing his immune system. Some people, I think, are being a little bit precipitous in describing that as being a forerunner to AIDS. And the unfortunate they're entitled to do that because in the interests of medical research and knowledge that we need to know what happens to those people. But the ones as reported are still healthy people. We need to establish whether that really is a prodrome, meaning a forerunner to the condition, or whether it's just a separate, unrelated condition. The problem is, in the meantime, a great deal of panic is being generated from it, and the panic at present in Australia is causing much more disease than the disease itself.
But the proven cases in America, there were 1 or 2 specific diseases that had very rarely appeared before, particularly in this age group. One of them was a rare form of pneumonia, is that right? And a cancer. Yeah,
there was a very rare cancer called Kaposi sarcoma, which was previously an old person's disease, only seen.
It's a skin cancer.
It's a strange, rather very odd-looking skin cancer, usually confined to older people in parts of equatorial Africa. Now, and usually in the form of single lesions, single spots. Now, the type of Kaposi sarcoma that's appeared associated with AIDS is a multiple rash that with a fairly acute onset.
And that's the sort of disease that in fact is killing people who have AIDS.
Yeah, in fact, the variety of AIDS that presents with this sarcoma actually has a slightly better prognosis than the AIDS that presents with as I described, an opportunistic infection.
And can you give us some examples of some of the other sorts of diseases that have proved fatal and are associated with AIDS?
Well, the most common condition is a bacterium which is normally a very low pathogenicity, meaning not a terribly dangerous germ normally. It's called Pneumocystis carinii, and it's been involved in about half the cases of AIDS, and it presents as shortness, a chronic cough, which progressively gets worse. But again, I don't know whether we're doing any harm with this show in making everyone with a chronic cough panic.
That's right. Well, we'll go into that, and later in the program we'll discuss sort of symptoms and when people should worry and when they shouldn't.
Okay.
But I just want to give some idea of what caused all this initial alarm. Now, to bring Terry into the conversation a bit, basically the situation there are certain groups that are more at risk. It appears at the moment, and certainly it's the homosexual community that is one of the highest risk groups. Can you catch this? What do you do to a syndrome? Do you catch it, acquire it? Anyway, in catching this disease, to put it simply, and of course this is why there has been. Well, one of the interesting issues is there is a strong argument this is why the illness, the disease, the syndrome didn't gain the attention it should have when it was in fact such a dangerous thing we'd stumbled upon, and the suggestion that because it involved homosexuals no one took much notice of it. Do you think there's any truth in that?
Well, I'm not certain that it's truth at the sort of immediate GP level, but certainly when you get up to medical research, the National Institute of Medical Health in the United States, for instance, is still sitting on something like $3 million which was supposed to have been allocated for research into AIDS. They've now allocated another 14 million for it. Congress has done this. But still, the 14 million and the 3 million is a drop in the bucket when you've got their public health officials calling it the number one killer of the 80s. They don't seem to be reacting to this sort of scare headlines with the money that diseases like Legionnaire's disease has pulled out of Congress.
Would you agree with that, Basil?
Yes and no.
Yes and no.
The doctors are making a lot of noise about AIDS because it's of intense medical interest. You're talking about immunology, which is, I guess, the branch of medicine with the most future. And until we understand immunology, we don't understand many of the common diseases, such as arthritis and cancer and so on. And it's a challenge to the study and our concepts of immunology. Now, I think it's, and that is why there is so much medical interest, and perhaps some doctors are overreacting because it is of such medical interest, and to the detriment of the general public. They're perhaps creating a little more excitement about the syndrome than it warrants. I mean, the authorities in this country, at least, judging from at least one case of AIDS that occurred at the end of last year in Sydney, if it follows the pattern that AIDS followed in the United States, we don't really expect very many more cases before the end of next year. Now, but unfortunately, some people have got the impression that it's here in Sydney and that there's hundreds of people just waiting to turn up at hospital casualties with it.
Well, we better talk about who is at risk, and we've obviously mentioned the homosexual community, but there are other groups. Now, if we go through the high risk categories.
Well, I think it's the total of 73% of cases have been homosexual so far. Intravenous drug abusers in the United States account for 15% of the cases. Now, and curiously, Haitians, who are people from an island in the Caribbean, resident in the United States, have accounted for another 5%. Now, they're the three major groups, and interestingly, they're three rather socially deprived groups, and morally deprived groups, if you want to call them that.
And groups which are relatively easy to ignore when it comes to spending money on medical research.
There's lots of spanners in the works. Now, of late, it appears that some children of AIDS sufferers have come down with AIDS. Some haemophiliacs who are recipients of other people's blood products. Usually vast numbers of people's blood products are used to make one dose of clotting factors, which they require regularly, which is all sort of contributing to the feeling that it probably is an infectious disease and possibly infectious via blood products. But on top of that, there's 36 zero-risk heterosexual men have come down with the condition in the United States.
And this is why it's so complicated, because there is, every time anyone comes up with some theory of what causes it, another group seems to turn up that doesn't fit in with that nice...
I've never heard of it. I've never come across a disease with so many theories attached to it, that date extremely quickly. And the number of theories purely reflects our ignorance of the condition. It's rather embarrassing for the medical profession, basically.
But it's a nice jigsaw puzzle.
Yeah, but it's the spreading of these theories through the community that's causing a lot of the panic. For instance, as far as I can see, there's no reason for haemophiliacs to panic here in Australia, but they are. And some of them are asking to go off their treatments, whereas our method of producing the clotting factor here uses far less people, or far less doses, and therefore there's less likelihood of them being contaminated if it is passed through the blood.
That's right. Well, we'll talk about the whole issue of blood transfusions in a moment. This is Bettina Arndt, and with me in the studio tonight is Basil, who's a doctor who specialises in sexually transmitted disease, and Terry Goulden, I'll never get that right, say it again, from the Gay Counselling Service, We're looking at AIDS, and we're also going to talk about, we're happy to talk to people about sexually transmitted diseases in general, as well as this specific disease. If you'd like to talk to us, the number to call is 269 0669. This is Bettina Arndt, and tonight we're looking at sexually transmitted diseases, and specifically AIDS. If you'd like to talk to us about any of these sexually transmitted diseases, the number to call is 269 0669. Basil, we're just looking at the whole question of blood transfusions, which is something that and blood donations, which is something that has really stirred up the homosexual community recently. We'll go into that in a moment. But firstly, I think we'd better look at homosexuals and what it is about the homosexual lifestyle that appears to make them susceptible to this particular disease. Can you just give us, we've already mentioned that it's a very complicated issue and a lot of this is guesswork, but there are some factors that seem to be contributing to it.
Yeah, again, it's just theory. I guess there's amongst the more accepted theories that the higher incidence reported in homosexuals is related to their promiscuity.
So it would be the promiscuous homosexuals as opposed to the monogamous homosexuals.
Yeah, very much so.
Who seem to be more at risk.
Yeah.
No. How about, do you know if they've found any homosexuals who live in a one-to-one sort of monogamous relationship with AIDS?
Of course there are. There's, we don't know. I mean, they're not falling, they don't come to the attention of doctors terribly much because they're not catching all of...
So I'm not saying are there any, I'm saying are there any with AIDS?
Yes, there are. In fact, one of the main AIDS foundations in the States is headed by someone with AIDS, and he has been in a monogamous relationship for 15 years and still has it. And the interesting thing is that his lover doesn't. So you've got this situation where it doesn't even pass between sexual partners.
That's right.
Well, that might not be accurate. It might not demonstrate itself in everyone. You know, assuming again that it's an infectious agent, it's rather obvious now that it doesn't affect everyone that acquires, that has been exposed to the agent, whatever it is. In fact, on appearances, it's probably a very low-grade infectiousness, because certainly if you get a person with 100 sexual contacts, the number that would come down with AIDS would be of the order of 1%. So it's not, you know, I think it's probably quite a good time now to sort of talk down some of the sort of mushroom cloud phenomenon which has been floating around in the last few weeks. AIDS doesn't really seem capable of suddenly exploding and presenting with thousands of cases in Sydney. It just doesn't behave that way. In fact, infectious diseases in developed countries anyway don't behave that way in general.
When you mentioned that we were likely to see some, at the end of next year, or not for a while, can you explain why that would be? Is there something to do with the incubation period? Or?
Well, the feeling is that it has a long incubation period, which would be between 1 and 2 years. Now, just watching American patterns in centres where it turned up in California after it was in New York, it took 2 years before substantial numbers of cases started happening. There were just single cases or 2 or 3 cases. I saw the same phenomenon in London last year, where their first cases appeared in 1981. By the end of 1982, they'd still only scored 5 or 6 cases of AIDS, all imported from the United States.
We really don't know anything about if it is infectious, when it is infectious, and whether people have it for a year or so before any of the symptoms come out, or all these sort of factors are really unknown as yet, aren't they?
Yes, but in disease in general, you're usually infectious during an incubation period. That's the current cause for alertness, not alarm. We need to do research, and there are plans to do research based in Sydney and Melbourne, and I think possibly other places in Australia, to try and anticipate and watch what happens to people as they go into the syndrome. And we're doing that now because Australia is assumed to be a virgin country in the sense of AIDS. We're working on the assumption that it's not here, and therefore we can watch what happens to our population, whereas the Americans didn't notice it until the phenomenon was well established in America.
That's right. Well, to get back to the homosexual lifestyle, that we've talked a little bit about the sort of promiscuous aspect, and there does seem to be a suggestion that the more sexual partners you tend to have, the more at risk you are, but it's not a clear-cut relationship.
It's not an entirely clear-cut relationship. It's just a tendency. If you're extremely promiscuous, you're significantly higher risk than if you're monogamous.
And then there's another factor in there. There's the connection with use of drugs, particularly intravenous drugs, which of course would only apply to a sector of the homosexual population, just as it does to heterosexuals.
Yeah, there's a parallel there with hepatitis B, which is transmitted only by very close physical contact, i.e. sexual intercourse, or via someone else's blood products, such as an exchange needle. If you get two junkies together, one of them carrying the virus, you're extremely unlikely to contract it in a normal household context, provided you're not having sex with that person. And AIDS appears to behave that way.
And then there's one more factor. There is some connection with anal intercourse, I believe. Is it?
No. Since all this has started, they've started looking at the immune systems of gays, and trying to work out what sort of practices they do have, what sort of practices are associated with certain patterns of, when they look at their immune system. There is no particular test for AIDS. You can't take a bit of blood, do a test and say you've got it or you haven't. So what we're trying to do now is work out what is the normal immune picture for a young gay man, I guess. And they've found that a lot of apparently young gay men have blood tests that make them appear, make their immune system appear to have flaws in it. And the most common association is the passive half of someone involved in anal intercourse.
And would they have any idea why this would be, taking the passive role? It's just pure...
No, there's another few hundred theories
yes, all right.
floating around.
Well, we'll come back in a moment and discuss a couple more hundred theories. This is Bettina Arndt. If you'd like to talk to us about sexually transmitted diseases, the number to call is 269 0669. This is Bettina Arndt, and tonight we're talking about sexually transmitted diseases, and particularly the new AIDS, acquired immune deficiency syndrome. If you'd like to talk to us, I have in the studio with me tonight Basil, who's a doctor specialising in sexually transmitted diseases, and Terry Goulden from the Gay Counselling Service. If you'd like to talk about any of the issues we're discussing tonight, the number to call is 269 0669. Terry, we were talking earlier about the fact that there is some suggestion that AIDS could be spread through blood donations, through people receiving blood from people who already have AIDS. And this is once again another area where no one really knows quite what's going on. But the way it's affected the homosexual community in Australia has been that the blood bank, in fact, banned homosexuals from donating blood, or tried to discourage homosexuals from donating blood. Could you explain a little bit about what that was all about and how people reacted?
Yeah, there is a theory that there's a high correlation between blood products and the passing of AIDS. As yet, with all of this, and as Basil will say, there's no scientific proof, and there probably won't be until they identify what the transmission agent is. On the blood bank thing, the blood bank here was asking for people to donate, and at the same time they were asked about AIDS because it's a up-and-coming subject from the States, and they said at that stage that they would prefer homosexual men to refrain. Well, this was a little precipitous, because in the United States the blood banks have worked out a series of situations in which they are asking certain homosexual men to refrain from donating blood. If they'd have carried out their program here, they would have reduced the plasmapheresis program by about 30% of its donors. And in fact, now they have specifically excluded that from the request to refrain. They need gay men to donate blood to the plasmapheresis program, because that is where they're getting the hepatitis B antigens for the serum from. with the other thing, they of course, a blanket ban on the homosexual community would exclude celibate homosexuals and monogamous homosexuals, whereas in fact what has been ironed out in the States and what is now being agreed to here is that they're asking homosexuals and bisexuals with multiple sexual partners, and in fact that should be across the board. If it is the increase in the number of sexual partners which is leaving oneself open for AIDS, then it should be everybody that has large numbers of sexual partners.
But all they can really do is point out these risk categories and ask people not to donate if they fall into one of these risk categories. There's no way of knowing whether someone's homosexual, whether someone's promiscuous or whatever.
That's right. They're doing this by a small leaflet which is handed out to everyone who goes into the blood bank, and they're requested to self-select themselves. And people who donate blood are fairly alert to these sort of things, and I'm sure most of them would self-select. So there's very little risk of it being passed through the blood, even if it can be. Tell
me how the homosexual community, the males you know, are reacting to this.
Well, it's difficult. Some people are reacting in a state of panic and sort of saying that they'll have to cut down on their sex lives, they won't go out, and they sort of reduce their drugs and all these sort of things. But that sort of lasts for a couple of days, and then they just adapt to the fact that this exists. And of course, the gay community here in Australia is actually in the most frustrating time. It hasn't appeared. We don't know if it's going to appear. We have a really high suspicion that it will. And this, of course, is creating more concern than actually if it was here. If
we're looking at the issue of promiscuity of multiple sexual partners, could you give any sort of estimate of the percentage of the homosexuals in Sydney, for instance, who are promiscuous, who would not be in, or the percentage in relatively monogamous relationships?
Well, if you look at normal statistics, and I sort of have to base this on the ones from San Francisco because they tend to know more about their gay community than we do here. We haven't yet been included in the census, so we can find out. About 25% of the gay community is involved in what's called the fast lane lifestyle, which here would be the Oxford Street lifestyle. I would say that holds true. There's about 20,000 maximum gay people on Oxford Street in any given week, when you consider that there's 250,000 gay men possibly in this city. You're still looking at about the same percentages. And the rest, of course, are all in the suburbs, living happy, sort of monogamous or maybe not monogamous sort of home lives, and it's really difficult to tell. And we don't know. I mean, even our counselling service possibly doesn't even reach those people in the suburbs.
And has your counselling service been receiving a lot of phone calls from people who are concerned about AIDS?
Oh yes, we are. We sort of, over the last year, we'd have lucky to have got 5, I presume. Now we're getting about 5 to 10 a night.
Well, maybe we'll come back in a moment and talk about the sort of questions they're asking you. In the meantime, we'll take a call. If you'd like to talk to us, the number to call is 269 0669. Good evening.
Hello.
Hello.
Yes, my question would be directed to, in fact, a venereologist.
Yes.
And it refers to a comment that he made, in fact, only a few moments ago with reference to the development of the Hepatitis B virus, or the Hepatitis B vaccine. The question is that vaccine, as he would know, is, in fact, at the present moment being pushed in Australia, and it's coming from the United States. And the question would be, with the incubation period, say, for AIDS, does he think that, and since the serum used to develop the vaccine is coming from either drug addicts in the United States or, in fact, from homosexual men who have, at that time, active hepatitis B, do you think that it's wise for health professionals, say, in Australia, to have the virus at the present time, or, in fact, wait out until we, in fact, develop a synthetic method of making the vaccine?
Oh, I think that's a very good question. Merck Sharp and Dohme, the company that developed the vaccine, have spent many hundreds of millions of dollars developing the vaccine, and halfway through the program, the AIDS phenomenon occurred. Now, they've gone to a special length to make sure the vaccine is treated in such a way. In fact, it's treated 3 times over to kill any possible and unknown virus or life form that might be present in the vaccine. To quote Professor Zuckerman, who's an eminent virologist in England, who says repeatedly and emphatically there is 0 risk of contracting AIDS from the hepatitis B vaccine. The vaccine is dead and dead and dead. I think, as well as that, there's been many thousands of people going back to the pilot studies with the vaccine, and that goes back up to 5 years now, and they've been watched quite closely for AIDS, and some of them belong, of course, to the at-risk AIDS groups.
Yes.
They've suffered the same, or in fact probably I think even a lower incidence of AIDS than the control population.
Okay.
So I think it's been around long enough to know that it's safe.
All right, thank you very much.
Thank you. Bye-bye. This is Bettina Arndt, and we're talking about sexually transmitted diseases. If you'd like to talk to us, the number to call is 2690669, and feel free to talk about diseases other than AIDS or syndromes other than AIDS. You can talk about warts or syphilis or gonorrhea. I mean, some of the old favourites are still with us, and I'm sure Basil will be very happy to give you advice on any venereal, any sexually transmitted disease that you might like to talk to us about. But Terry, we were talking earlier about the reaction of homosexuals to all this public discussion of AIDS. Can you tell me the sort of calls you've been getting at the gay counselling service?
Well, it's basically people want to know if they've got it, and they ring up with all sorts of wonderful symptoms. I mean, after one of our public health officials announced that there was a link between AIDS and herpes, we had a large number of calls on cold sores. People had cold sores around their lip, and they wanted to know whether that meant that they had AIDS. With all of these people, regardless of whether we think that they've got the symptoms or not, we are advising them to go to doctors and be checked out. There are a number of gay doctors here in Sydney who have sort of fair knowledge of the symptoms, and it's much safer for people to be checked out. There's some controversy about one of the tests, which is a skin test. Unless that is properly interpreted, it's possible that people can get the wrong information from it, but still it's far better for people to know than to sit there in panic and worry.
Well, I think the least we better do is have some sort of discussion about symptoms here. Basil, are you brave enough? How do you know if you have AIDS?
You don't really.
I knew you'd give a nice, helpful answer like that.
And in fact, it's quite a challenge for a doctor to diagnose it. Again, it's been reflected recently that perhaps it's being overdiagnosed a little bit. I've got a pamphlet here from the Californian crowd called the Kaposi Sarcoma Foundation. And they list symptoms here, which I guess is as good a list as any. But they put in italics, or they stress at the start of it, you should be alerted but not alarmed if you have one or more of the following symptoms. Meaning, what they mean by that is, if you have any or all of these symptoms, it's extremely likely that you don't have AIDS, but it's possible. Now, I'll list them. Low-grade or persistent fever, night sweats, dry coughs that are not related to a cold or to smoking, shortness of breath with minor exertion, loss of weight that is not related to dieting or increase in physical activity, extreme fatigue, blurred vision, persistent and severe headaches, swollen lymph nodes in the neck or under the arms that are not linked to a transient infection of known origin, creamy white patches on the tongue, persistent or recurring itch. I'm trying to get through this fast so that no one will remember it. Persistent or recurring itching around the anus, diarrhea, bloody stools, or gastrointestinal upset that does not go away, cuts and infections that do not heal as quickly as usual, skin rashes or discolorations that don't go away and may get larger. So as you can see, they're extremely vague symptoms.
But I also say something that every time I go through that list with someone, I think Yeah,
I've got
half of those symptoms, and I have to keep reminding myself that I also suffer from a chronic sinus complaint.
I've got about 4 of them.
That's right. Well, maybe we should pick up the point that Terry made earlier. What is the connection between AIDS and herpes?
Well, herpes is, I don't know whether we got it across a few weeks back. Herpes is a fairly good example of an opportunistic infection. I think opportunistic is a word that the general public understands these days after watching politicians.
Well, I think you better explain yourself a bit more.
The germs that normally your body can cope with well, but if there is some flaw in the way you might handle it, then the disease manifests itself more severely than it should. Now, herpes is a normal phenomenon. Well, I think it's common enough that we have to call it normal. But there is a way that herpes is expected to behave in a healthy person. Herpes you would only suspect in AIDS, or as being a sign of AIDS, if it's unrelenting and progressive or invasive. And by that I mean going on and causing meningitis and pneumonia and so on. So it's in that sense, the opportunistic infections, there's not much fear of people diagnosing AIDS in themselves, because they'd be so sick they'd be in a sort of passive role in a hospital somewhere. And
I mean, that's really one of the main signs that illnesses like herpes not behaving as they should. And herpes, as we stressed the other day, and I in fact had a letter from someone complaining we didn't take herpes seriously enough. Herpes tends to get better and tends to have less, in terms of having less effect on you, and occurring less frequently, the attacks of herpes, and causing less distress. And if it didn't behave like that, then you may have some cause to worry. And this applies to all sorts of other things connected with AIDS.
Yeah, but again, if it's not behaving the right way, you almost certainly don't have AIDS, but you might.
But you could. Okay. We'll have to take a break in a moment. This is Bettina Arndt, and I'm talking tonight about AIDS and other sexually transmitted diseases. If you'd like to talk with us, the number to call is 269-0669. If you have any illness or disease that you think you could be one of these sexually transmitted diseases, feel free to ring up and talk to Basil, who is an expert in these sort of areas, or to Terry. Terry is from the Gay Counselling Service, and he'd be very interested in discussing any aspects of homosexuality and sexually transmitted diseases that might be worrying you. The number to call is 269-0669. This is Bettina Arndt, and we're talking about sexually transmitted diseases tonight. If you'd like to talk to us, the number to call is 269-0669. We'll take some calls. Good evening. Hello?
Hello.
Yes.
Oh, yes, I wanted to speak to you about herpes, please.
Yes. Did you want to speak to Basil?
Oh, yes.
Yes, go ahead.
I just have a query about it. Is it possible to sort of grow out of it?
Grow out of herpes?
Well, I think my husband gave it to me originally.
Yeah.
And I think he just had the one sort of lesion, is that what you call it?
Mm-hmm.
And then he never seemed to have had it after that. It's been diagnosed by a gynaecologist that I've had it about 3 or 4 times in the last 5 years.
That's what you're talking about is a perfectly normal phenomenon. About almost half of people who contract herpes never have a second attack. I think some people feel uncomfortable with that, but it is a virus and your body does adapt to it, and some people's bodies adapt better than others, and that's why half just never get that second attack.
Second, please.
What's she doing? Closing the door, telling, sorry, you're back again?
Yes, I had a child picking up the phone.
Yes, I know the problem. Talking to women, I always envisage them in the same situations as I always find myself, with children sort of doing dreadful things while you're trying to have a sensible conversation. Sorry, go ahead.
So, once you sort of get out of the round of having the infection, are you still, even though you're not having the infection anymore, it's been about 2 years.
Yeah.
Is it possible I can still sort of infect someone with it, or is it out of my system?
It's very unlikely. No, it's probably still in your system. It just lies dormant. It doesn't do anything. It seems to lie deep in the nervous system. Now, you may get another attack tomorrow, or you may get another one 10 years from now, or you may go to your grave and never get another attack. If you haven't had many attacks, it's probable that you would get fairly clear-cut symptoms with a recurrence. And that's the only time I think you should be anxious about being infectious.
Right. So you're only infectious virtually when you've actually got the lesions and the blisters.
Almost always. Yeah. There's no 100% in medicine, and there are some unfortunate people who get virtually no symptoms and quietly secrete the virus for a long time. It's a very small number of people, but it's probably part of the reason why herpes spreads itself around so well.
Oh, I see. Right. Okay, then.
But the odds are fairly good that unless you have a sign of having an attack, you won't be infectious. I mean, this is what it's all about, really assessing the odds, I think.
Does that mean that my husband has a very good sort of immunity to it?
Oh, yeah, it's good. I mean,
because I'm sure he's been my only partner, and everyone insists that it's only intercourse that spreads it.
I don't know if that's absolutely true with herpes. It's a pretty hardy little virus. It's a lot tougher than other germs that I deal with. I don't think you can say that it's entirely... It's a sexually transmissible disease. It's not always just sexually transmitted.
About 99%, probably. Mm.
Well, you never know. People tell me all sorts of things.
Mm. Okay, then, fine.
So you can let your husband off the hook.
Well, he was very rampant before marrying me. So.
Yeah. And that's the point. It can also hang around a long time. So, the point is that there's no need to go blaming people in this circumstance because there are these ways out. All right? Thank you for your call. Bye-bye. This is Bettina Arndt, and if you'd like to talk about sexually transmitted diseases, the number to call is 269 0669. We'll take another call. Good evening.
Hello.
Hello.
I was just wondering, can you hear me?
Yes.
I wanted to inquire that if a woman married a gay person and didn't know they were gay and had 2 children to them, would it be possible that they could pass this disease on to them, or whatever it is, AIDS or herpes?
Terry, I'll leave this one to you.
Well, it's going to depend on whether the person that they marry, the gay person that they marry, is, I would think, sexually active as a gay person as well as within the marriage. There is a possibility that if they have large numbers of sexual contacts, that they can pick up AIDS and they can pass it on to their marriage partner. But all the stuff I've seen out of America, the sexual partners that seem to have picked it up have almost always been sexual partners of people on intravenous drugs. I haven't seen very many cases of it being passed to sexual partners of either bisexual people or homosexual people. But again, I mean, with all of these things, there's so many suppositions that I couldn't say for certain one way or the other, and I don't think anyone could.
Well, I was just wondering about the children. What age?
Oh, I think the children are beyond a certain, beyond their infancy. There's been no documented risk at all.
Yeah, one's 8, one's 10.
No, if they're over 6 months, so that they're not, if you like, constantly exchanging body fluids with their mother, they're really at no risk.
Oh, that's a relief. Thank you.
Thank you. Terry, I think we should... one of the questions that a lot of people seem to be asking is, whether they should move out of the house if they happen to be sharing a house with a homosexual. The sort of issue of people being at risk from sharing households with people who are gay and living a sort of normal gay lifestyle. Is that the sort of question people have raised with you?
Yes, well, not so much with us, but certainly with the STD clinic. I've been speaking with them at length, and this has been a common question. People who have gay people boarding with them, they ask, should they ask them to leave?
After the wonderful 60 Minutes program, I'm sure that did a lot to encourage that sort of attitude.
I'm sure it did, yes. The answers they're giving, and they're quite true, is that unless there is intimate sexual contact, there seems to be no possibility of passing AIDS. And even with intimate sexual contact, it's still not a proven transmission, but it's still only a high correlation. So I don't think people who are living with gay people are at any risk in developing AIDS.
I think that's it's a point worth dwelling on a little bit in about sexually transmitted diseases in general, because people who want to persecute gays will often express anxieties about working with them, or sharing coffee cups or something. I think it's probably irrefutable that if you're a promiscuous homosexual man, you're at risk of contracting sexually transmitted diseases, most of which are quite treatable and relatively minor. It's just a matter of getting over the emotional crisis involved. You're not infectious in a non-sexual way, almost by definition, because all of these organisms are extremely fastidious and they don't like living on the sides of coffee cups.
And it's really only another promiscuous homosexual who is really fairly likely to catch the disease. I mean, it's only that sort of contact. I mean, and it's spread between this really relatively select community.
Yeah, I've known none of these conditions to spread themselves any other way than sexually. I've never known of a workmate of a gay to come down with something.
It's interesting too that we get a lot of married gays ringing us. One of the fears that they have constantly is picking up a sexually transmitted disease and passing it to their wife. But the number of cases that I've actually had reported through our phone service that this has happened and they need sort of help or counselling or information about, is so low. In fact, I can't even remember the last time we had one. It'd be 1 or 2 in the 10 years that we've been operating. It seems to me that most gay men, especially those that are promiscuous, are also relatively aware of the dangers that promiscuity brings with it, the dangers of picking up diseases, usually fairly up on the symptoms, and in fact can tell you all the symptoms. You don't have to tell them.
It's part of the reason. Part of the reason why sexually transmitted diseases appear to be so high amongst homosexual men, and I've got a little bit of a sort of background suspicion as to why AIDS may appear so common amongst homosexuals, is that they tend to be very health conscious and tend to go to a specialist medical facility, whereas your garden variety heterosexual husband will go to a discreet GP and get a shot on the quiet.
But it'll actually probably avoid even thinking about the fact that he might have something wrong with him for a year or two. And that's one of the differences.
Whereas the gays will turn up at a clinic and get documented and put into the statistics. And sometimes I wonder whether AIDS has been perceived as a gay phenomenon because they tend to have some very high-powered clinics and lots of good perceptive doctors employed.
And the men are less hung up about actually going along and talking to a doctor about it. We'll have to take a break for the news. If you'd like to talk to us about sexually transmitted diseases or any other topic we've dealt with tonight, the number to call is 269 0669. Bettina Arndt, and tonight we've been talking about sexually transmitted diseases, and particularly the most popular, certainly the diseases that are catching most public attention at the moment, namely AIDS and herpes. With me in the studio tonight is Basil, who's a specialist in sexually transmitted diseases, and I'm not giving his name for ethical reasons, and Terry Goulden from the Gay Counselling Service. The point about AIDS is that it has the homosexual community is particularly at risk, and that's why Terry's here tonight to look at some of the issues of sexually transmitted diseases in the gay community. If you'd like to talk to us about any sexually transmitted disease or any of the other issues that we've been talking about tonight, the number to call is 269 0669. Basil, I just thought it might be worth broadening the discussion a bit away from these sort of new popular scare topics and look at some of the more traditional sexually transmitted diseases and look at the incidence of these, particularly what's happened to the ones, the venereal diseases that we all used to be frightened about, gonorrhea, syphilis and so on. How common are these compared to the ones that everyone's talking about now?
Oh, much more common. In reality, they're much greater. if you're gay or heterosexual, you're at very real risk of many of the sexually transmitted diseases. Now, you're at risk, it's true, but there's also treatments available. We're getting better at diagnosing the conditions and working out the optimal treatment. Even more slowly are we providing adequate facilities to handle the caseloads. All of the clinics in Sydney are booked out almost permanently, and there's no plans for more clinics yet.
Well, maybe if we discuss some of them specifically, which is the most common sexually transmitted disease?
In pure case numbers, the most common condition that people present for, if it's a man, would be a condition called NSU, non-specific urethritis. Because it's so common and the symptoms tend to be so mild in a man, it's often run down. My personal belief, and the belief of most of my colleagues, is that it heralds probably the most significant condition of the lot. And that
Can you tell us a little bit about that, and what are the symptoms? And
well, the conditions, the germs involved in NSU, and I think it's difficult to talk about in this way, but the germs involved, at least in the first episode of NSU, are quite infectious and quite dangerous to a woman, and can cause a condition called salpingitis, which is an infection in the tubes, which can ultimately lead to chronic pelvic pain or infertility.
So it's not specific to men. Women. It's
not specific to men, but the problem is women usually aren't getting much in the way of symptoms, if at all, from it. As our perception of the condition improves, I think we're slowly handling it better. But women are still the ones who are suffering, because it's very difficult for a woman to go to a doctor and be tested for it.
In males, what are the symptoms they might notice?
Well, I think any man who has a discharge, which is secretions coming from the penis, should be alerted. You know, sure, if it happens just once, it may be a normal physiological event, a little bit of prostate overload or something. If it happens more than twice in the same day, or if it happens if it's still there the second day, then almost certainly infectious disease, and he's behaving irresponsibly if he doesn't seek medical attention as soon as is convenient. And his symptoms can be relieved very rapidly, and he's in very little personal danger. The people who are in danger are the people that many men don't bother to contact, which are the women or their homosexual partners that they've exposed.
Well, this is the biggest problem of all with the sexually transmitted diseases, is chasing the contacts, isn't it?
Yes.
and basically people behaving responsibly in terms of being willing to tell people they've had sex with.
Yeah,
during that period.
The gay community has steeled itself and is used to the phenomenon of making a few discreet phone calls after you visited the doctor. That's a much more uncomfortable phenomenon in a heterosexual environment. And it's still our biggest single problem is contact tracing.
Yes.
You know, it's impossible to police it. You can't send out policemen chasing contacts. And anywhere that's tried, that failed miserably. So you have to rely on the maturity of the person that has been diagnosed, and unfortunately you can't always rely on that.
The best possible advice to give anyone is to, if you have sex with someone, is to at least exchange telephone numbers. Even if they won't give you theirs, you can give them yours, because if they come down with something, they may be responsible enough to telephone you. And people shouldn't be upset when people telephone them to say, you know, I think I've been diagnosed, I have this, and you possibly have it too, you should get checked up. I mean, it really shows that they do care about other people.
They're friends as well as lovers.
They're friends as well as lovers,
yes. Unfortunately, a lot of people aren't. We better take some calls, but we'll talk a bit more about some of the other sexually transmitted diseases after that. Good evening.
Good evening. I would just like to know, please, of those people who have died in the US, what have they actually died of? Is it a disease called AIDS, or is it something else due to the lack of immunity?
Yeah, there's no particular event that they die of. If the phenomenon manifests itself as a cancer, then the cancer will lead to a cancer death in the usual way. If it's an opportunistic infection, it's just the infection becomes overwhelming and untreatable, and that's the terminal event.
Okay, fine. Thank you.
Okay, thank you. Bye-bye. And this is Bettina Arndt. If you'd like to talk to us, the number to call is 269-0669. Good evening.
Yes, good evening. Several things I'd like to talk about. I heard on the same station just recently that one school of thought in the States was that this aid was related to swine fever. Have you any thinking on that score?
No, there's been several viruses investigated. The swine fever virus was, every time a case of AIDS comes down, they biopsy and culture every apparently abnormal bit of the anatomy, and they've turned up various human leukemia viruses that have been found either causing or in a parasite relationship on people who've had other cancers. But all of that sort of work is really quite cursory at present, and it's got years ahead of it before they'll pin any particular virus down as being particularly involved.
Well, this was related to swine fever coming related to Africa and then to Haiti. And they stated then that pork meats, that's okay, they're cooked, but it's the skin of the pork used in sausages that is the problem. Have we got a similar problem in this country?
Well, I doubt it. The connection in Haiti is that the swine fever virus was discovered there, and at the same time they now think that AIDS was also discovered there, and I think the postulation is that the swine fever virus mutated and was eaten and has become AIDS. It's really, I think, a medical long shot at the moment.
It's probably number 999 on the list of 1,000 theories.
Very complex thing, isn't it?
It is. I think really this year, next year, and the year after, we're just purely at the stage of collating the known information. There's lots of little red herrings, like cases of AIDS turning up in Paris that have no connection with the United States. The cases appear to be derived from Central Africa.
What's happening in this country relative to research? Is the government supporting this research? Are they hopping in and spending lots of money?
Not lots.
Not lots. There's one research project that we know has been given partial support, insofar as the professor has been given some equipment to play around with. But until he gets support from the government in terms of salaries for research people, we're not going to get anywhere. Sorry.
Piddling thing, isn't it, relative to the problem that confronts us?
Oh, yes.
This is something that every Western country, anyway, should be hopping into. Does this affect the world, or is the Russian complex immune from this kind of thing?
Well, I think you've got a good point there. AIDS is obviously turning into an international phenomenon. Australia is, as I said earlier, if you like, a virgin country in terms of AIDS, and we have a sophisticated medical system. And I think there are certain types of studies that can no longer be done in the United States or Europe because AIDS has, in a sense, established itself there. We could offer a lot of information to world knowledge on the topic if we got our act together quickly and did what we call prospective studies, which is watching people from now on into the future.
What's the United Nations Health Organization doing in this score? Anything?
That's a good question. They're basically in the same job of collating information.
I think we need to more than collate information. We should be putting so many people to work on this score that it's not funny.
But you've got health budgets and research budgets. There are politicians and ministers of health that have to decide the priorities, and there has been an awful lot of medical discussion about AIDS over the last 2 years in Australia, which is quite unique for a disease that hadn't even arrived here.
It's shades of the tests on alcoholic content of drivers, you know. A Minister for Transport said it'll never happen while I'm Minister for Transport. And look what's happened. The proof is there in the eating, you know, the pudding. Proof of the pudding's in the eating sort of thing. We've proved the fact that alcohol is a problem. Okay, well, why should we waste time with politicians? Let's hop in and do something about it.
Unfortunately, politicians control the money to research.
We should control the politicians.
We try to.
I'd like to ask you about is hepatitis B. This is a sexually transmitted issue.
In many contexts, yes.
Partially so.
No, so hepatitis B, in certain parts of the world, is endemic. You know, if you're talking about mainland China, it's usually transmitted from a carrier mother to the baby, and it's acquired at birth.
Well, let's take this country.
In this country, it's usually, I would hazard a guess to say that it's more often than not sexually transmitted, with the proviso that it's also transmitted via intravenous or use of intravenous implements, either via blood transfusions, which is actually very rare for hepatitis B, but you know, junkies exchanging needles and passing the virus that way.
If you wipe those out, it basically comes back to being a sexually transmitted issue.
Yeah, for the majority, and that's.
Can this be the cause of liver cancer of the liver? Well, there's 150 million hepatitis B carriers in China, and liver cancer is the most common cancer. But that seems to be a slightly different phenomenon to the hepatitis B we see here, where we're usually contracting it as adults, and it doesn't seem to have quite the same propensity. It's still quite possible that it can lead to liver cancer, but not with the regularity and on the scale of China. I've a personal interest in that issue, and also in this following one on herpes.
Yeah.
One of my sons went to Bangkok, amongst other places on overseas visits, trips, and he came back with cold sores, which have manifested themselves all along. I always consider that cold sores were cold sores.
Well, they are.
Herpes appear to me to be an issue that relates to a sexually transmitted issue.
No, that's genital herpes. Herpes is what is, you know, it's like all of the germs I deal with. You can't cough them across the room or give them to the person next to you on the bus. There has to be direct skin-to-skin contact. Now, most people contract herpes on the lips from kissing someone, usually one of their parents or grandparents, or just normal contact, skin-to-skin contact that children have at school. And genital herpes, just by virtue of its site, you're most likely to pick it up from someone with whom you oppose genitals.
Yeah.
But it's not, I mean, herpes of the lips is far from being a true sexually transmitted disease in that sense.
Herpes, when it affects the eyes, what category does that fall into?
Category? Well, it's not a terribly good, it's a rather nasty condition.
But is it relative to, it's no longer related to such a thing as cold sores, it is definitely...
It's the same virus.
It is?
Yeah, the person who contracts facial herpes, it's the herpes simplex, usually type 1, that they happen to get such a heavy inoculum that happened to include the eye, or the eye got contaminated while they had no sort of circulating antibodies, and if the virus gets established in the eyes, it means recurrences happen in the eyes as well, and it can lead to progressive scarring.
It's very rare that, I mean, because as we talked about a few weeks ago, well, most of us have herpes type 1, or have had it at some stage. It'd be fairly rare to have involvement of the eyes. Yeah?
It's considering the commonness of herpes, the complications are very rare, yes.
Yes, but can you relate this to a sexual issue?
No.
Can't.
I don't think it can.
There's also a possibility, too, that people are immune from it. Because my lover has herpes, the one variety, and I've never, ever contracted it from him.
You could have it without symptoms, couldn't you? This is the sort of discussion we got into last time.
Yeah, you're probably like the majority of people. You had your first attack before you ever started school, and it's long forgotten, and your body coped with it immediately.
Yeah.
Yeah, I'm a person who served during World War II, and we had constant checks as far. The old story was that the girls had to be worried about a soldier because he had his overcoat, his greatcoat on his arm, because he had one thing in mind, sort of thing. So they had to watch out for them. But if ever anybody was reasonably safe, it was a serviceman by virtue of the checks that were imposed on him by virtue of the medical setup within the forces. But I feel that there's not sufficient known today by people of what symptoms are of VD. I think VD is something that should be spoken about more often, and people should be aware of what the symptoms are. But should be able to say.
But people tend to filter out the information that's given to them, because all too often people believe they're immune to these things or incapable of catching them, so they're not really listening when someone attempts to tell them what the symptoms are. And I think that's fair enough.
It's part of the "it'll never happen to me" syndrome, isn't it?
Yeah, I think we do need a continuous reference source. We need to be able to ring up somewhere and ask, if I've got these symptoms and I suspect them, do they sound suspicious to you?
Well, under those circumstances, I think, from what I've heard, without any personal experience on the score, that some of the clinics aren't even fully attended, even during normal working hours. I believe Westmead, for instance, is only a temporary, manned only temporarily during the day.
Oh, that's the Parramatta Hospital Clinic. Yeah, there's one doctor working there part-time, and there are no funds forthcoming either to make him full-time or to get a second doctor.
All the things that should affect our country and our life and our future life and our future generations, it should be VD.
Yes, anyway, well, thank you very much for your call, and you've made some very important points. Thank you. Terry, I know you're itching to get a word in there, and I assume it relates to the issue we were talking about earlier about funding.
Yeah, I'm just interested in the comment about education, because, it's been one of our complaints all along. We're told that VD, or sexually transmitted diseases, are endemic in the gay community, yet there hasn't been one penny spent on education by our state government specifically to the gay community. Most of the education has been carried out either by people from the STD clinic in their own time, or by the gay community itself. We have a very high awareness of the sexually transmitted diseases, but it's purely from our own community doing it. Now, as far as I'm concerned, the government should be targeting the gay community with education, as well as the general community. And I don't believe that's being done at all.
And particularly when we consider the point Basil was making earlier, that in fact many cases the homosexuals are more aware of health issues than heterosexuals are. And in some ways that education may be better served to being directed towards the homosexual community rather than heterosexuals who don't necessarily listen to what they're being told anyway. But that's a
well, the problem is, in a heterosexual context, the long-term damage is much worse. I've dealt with homosexual men who, a small number, who've contracted numerous infections, some that we used to consider major diseases, such as syphilis, and several times. You can still see them 10 and 20 years later, perfectly healthy, extremely fit, well men. In a heterosexual context, the diseases are always nasty because half of the population involved are women, and women tend not to be handled with as much expedience as they should be. And because they have vital organs involved, such as tubes, they tend to suffer greater long-term damage and problems from it.
Yes, and also that a lot of this, they can be carriers of a lot of the sexually transmitted diseases without any obvious symptoms.
Yeah, they usually have no symptoms.
We were talking earlier about, what were we talking about? I was just trying to think which are the ones that women do have symptoms, which they tend not to.
Well, in reality, almost all of the diseases, because it's just due to their anatomy, it's quite difficult. It's quite easy to have things internally.
Yes, when we were talking about herpes, we mentioned the fact that you can get herpes on the cervix and places where women aren't likely to notice.
No.
If they do have an attack. Can you give us some other examples of that?
Well,
what about genital warts? You mentioned that earlier as a sexually transmitted disease that's becoming more common.
It's become extremely common, and I think probably for every person who has visible warts is at least another one carrying the wart virus.
And in women, presumably, sometimes they're inside the vagina or places where they're not very easy to see.
Or they can be on the cervix and be a cause of abnormal pap smears. There are some people who think there may be some sort of link between cervical warts on the cervix and cancer of the cervix. I mean, that's very, very much at the theory stage, but it's as good a theory as any of the others.
And the symptoms don't even have to be particularly hidden away when you consider the fact that an awful lot of women, in fact, never even look at themselves if they can avoid it.
No, I think
they could even be on the external genitals without women noticing that they have something growing or breeding or developing there. And I think that's one of the big problems.
Well, the thing with all of these conditions is they don't appear on the mortality statistics. They don't. Rarely do these diseases kill people in the short term, and probably not very often in the long term. It's all a question really of quality of life. I think it's been stressed in a few television programs in the last week that 1 in 10 Australian couples are infertile, and at least a third of those are infertile due to pelvic inflammatory disease, which is frequently of a sexually transmitted origin.
See, that's one way of making people take it seriously, isn't it?
Yeah, that makes it a major a major quality of life phenomenon, even if it doesn't enter its way onto the death statistics in a spectacular manner such as AIDS. It's very important to people, and we're spending lots and lots of money in terms of $100 on treatment of the complications for every dollar we ever spend on the prevention.
And it's a case of also early diagnosis and treatment, particularly in the case of women, that a lot of these diseases, if you catch them early and treat them straight away, they don't affect the woman's reproductive system in the same way. Yeah,
that's true, but by the perversities of our current health funding system, if you don't have a symptom of a sexually transmitted disease, the Federal Department of Health has instructed your health fund not to rebate you for a consultation involving testing for sexually transmitted diseases. That's a rather hot little issue.
Well, that's not a bad political issue, is it? We better take a break for the news, or the news headlines. If you'd like to talk to us about any of the issues we're discussing tonight, particularly about sexually transmitted diseases, the number to call is 269 0669.
Are you looking for a new Ford this weekend? Maybe a new TX5 Gia hatchback or a Telstar? Then Peter Warren Fairfield at 364 the Horsley Drive is the place to go. They have plenty of stock, and they offer top deals, top trade-ins, and top hospitality with on-the-spot service from pancakes on the rocks. That really hits the spot. Give Peter Warren a try this weekend, and you won't be disappointed. Go to Peter Warren, 364 the Horsley Drive, Fairfield.
This fella one week went real big on the horses. Drove a rented Rolls Royce around all the courses. My system can't fail, that's what he told us. Yep, he lost the lot and came home on the bus. There must be a better way to be a millionaire. There is. $1 million lottery tickets are now on sale. They're a better bet because you know how much you'll get. $1 million, just like that. A better way to be a millionaire. The $1 Million Lottery.
2GB News Talk 87 updating the news. Airlines are making plans to counter a series of rolling strikes by pilots protesting against the federal government's proposed tax on lump sum superannuation payments. The countdown for the American Space Shuttle Challenger is proceeding on schedule. Challenger will lift off at 9:30 tonight our time. Prison officers at Sydney's Long Bay Jail have joined the protest against the transfer of convicted murderer Peter Schneiders from Goulburn to Bathurst Jail. And updating sport, Richard Fisk reports that in rugby union, New Zealand won today's second international against the British Lions 9-0. Mike Bailey's Sydney weather, cool with rain periods. The expected top temperature for the city, Liverpool and Richmond, 16 degrees. There'll be a full Macquarie National News Bulletin on 2GB at 8 o'clock.
You're about to enter the shock zone. Mrs. Smith has just received her heating bill and has entered the shock zone. What Mrs. Smith didn't realise was that a single visit to Mitre 10 for easy-to-install Boral Insulfoil R2 Plus bats in the ceiling would have meant a saving of up to 33% on her heating bill. If you're about to enter the shock zone, don't wait another minute. Ring 684-4266 and let Mitre 10 and Boral Insulwool save you from the shock zone.
Sell property faster. Citicorp's vendor finance brochure explains how. Phone Citicorp.
I believe there was a young girl called Gloria
who came from the state of Victoria.
Well, you know, when her parents moved north to, Queensland, of course, she was overcome with, euphoria.
The Samuel Peep Show, just for laughs, every Sunday afternoon at 12:30 and Monday to Friday after our 11 a.m. and 3 p.m. news on 2GB, News Talk 87.
This is Bettina Arndt, and we're talking tonight about sexually transmitted diseases. If you'd like to talk with us, the number to call is 269 0669. Good evening.
Hello.
Hello.
I have a friend who had an attack of herpes about a year ago, and he's abstained from having sex during that time, and he's wondering when it would be all right to resume sexual relations with a woman without infecting her.
It would have been all right 11 months and 2 weeks ago.
Why is that?
You're only infectious during the outbreak, with the usual proviso. You're almost always only infectious during the attack with herpes. So as soon as the skin has healed over after the ulcers have healed, the person is no longer secreting the virus, so they are no longer infectious.
What about the fact that you said it was dormant?
Yeah, dormant means just that, it's asleep. It's not in a part of the body that can be transmitted to another person.
I see.
And I think it's most important that he gets back into having sex quite soon before he finishes up with, well, it sounds like there's a lot of other factors working there if he's gone celibate for a year.
Okay then, thanks very much.
Thank you, bye-bye. Good evening.
Evening. I'd like to ask Basil a couple of questions, if I may.
Yes, go ahead.
Look, Basil, can you tell us how many people in Sydney at the moment have the prodrome for AIDS? I noticed in the Medical Journal of Australia...
Medical Journal of Australia talks about a prodrome for AIDS. The Centre for Disease Control in America doesn't recognise the prodrome. There is an urgent need for research to see if there is some sort of link between the abnormal lymphocyte function and the lymph nodes found in certain homosexual men, whether that is the same phenomenon or a forerunner of AIDS or what. There is a need for research. I do not call that a prodrome for AIDS, and nor do I like the term suspected AIDS, which I've heard bandied about. I think that is generating panic and generating disease.
Well, it's obvious, it's well known that emotional stress reduces your ability to fight off diseases.
Good point.
But also, of course, so does absenting yourself from the presence of disease. That's, of course, another great way to stop it happening to you. You won't get the disease if you absent yourself from the presence of it. And I think the thrust of a lot of what's been going on in the gay community over the last few months has been to get people to reduce their exposure to any possible chance of infection. And I really think that is a pretty laudable idea.
I think it's a laudable idea. I'm not willing to be the person that tells the whole of Sydney to stop having sex tomorrow or to slink themselves into purely monogamous relationships against their natural tendencies when the evidence is so thin that it is, when there is no clear-cut evidence of an infectious agent yet. I think the best we can hope to do is discredit the medical profession and alienate the population if you advise them to if you advise them to change their behaviour on such thin evidence. I think there are grounds for moderation in sexual activity.
In all honesty, Basil, do you think that there's a chance that it is not present in Sydney? Do you really think it's not here?
Well, I'm working on the assumption that it is here, but I'm working on the assumption also, as has been noted elsewhere in the world, that it's probably here incubating and won't manifest itself for at least a year or so yet in any significant numbers. And that's in places that have imported AIDS, such as Denmark, London, Paris. That has been the phenomenon. It hasn't behaved as a 60 Minutes program tried to put across, like some sort of rampant bushfire. It just, and I think, half my working life these days is trying to delve people out of pits of depression and fixations on AIDS, when I think that sort of disease I call almost as bad as AIDS itself.
Well, I've got to tell you that I disagree with you.
Good.
The complacency factor with this disease, I think, would be far more dangerous than being very much aware. If we can cut down our exposure to the disease before it strikes, and get into social habits that make it less likely to be rampantly contagious before it becomes a serious problem, I think it's the time to act is before we've got the problem than after it's raging in our community.
Well, I agree. If people stopped having anonymous sexual contacts or numerous sexual contacts, there is a possibility that would help slow the spread of AIDS.
Well,
but I also sincerely believe that authority figures, if I dare call myself that, anything that comes out of my mouth is filtered most heavily by people in general. They usually draw their own conclusions. Now, no moderation has been suggested in the United States, and the incidences of the most easily documented sexually transmitted diseases are dropping this year. Now, people have behaved that way spontaneously. And there are a lot of agencies in the United States handing out a lot of advice on very thin evidence. And I'm not really willing to enter into that debate, other than do what I'm doing now, which is make people aware of the phenomenon, but not panic about the phenomenon.
Well, Terry, you wanted to make a point?
Well, I just think that by panicking about it, if it turns out that everything is wrong and that there is another way that AIDS is being passed, then I think Basil's right. The medical profession will lose its credibility. What the good things that are happening out of this, which is the lessening of sexually transmitted diseases, will reverse again. And I think what we need to assure people that if they act in moderation, and you have to define moderation, but if they act in moderation, if they reduce the number of anonymous sexual contacts, they stand less of a chance of contracting AIDS, and also they stand less of a chance of contracting all the other STDs that are around.
Can I just ask a question of Basil? There's another question I'd like. There's 2 or 3 points I have yet to go, but there's one interesting comment that's been coming, I believe, even from you, and I think I could agree with it, that condoms may have a major benefit in cutting down STDs and possibly in isolating the partners from the infectious agent of AIDS. Is that correct?
Oh, I wouldn't go as far as saying that. That's been common advice in America. I've never actually said it myself. Simple logic would say if there was an infectious agent, it's likely that a condom would be would assist in stopping it being transmitted, as has been documented, not very well actually, with other sexually transmitted diseases. But again, sure, I'll say that on air. I would just tend to doubt that people are going to rush in and use the damn things.
Do you think they would be valid if they did use them?
I think they would have an impact, but...
So you would recommend it?
All right, I'll recommend it, yes. But,
now, there's one other thing.
I think that is worth... I assume the reason Basil is hesitating is the point is you can use a condom and still contract the disease. It's not a guarantee, but it may help.
It depends on how it's used. A lot of people use a condom as a contraceptive, which means they may just put it on halfway through the act of sexual intercourse. In my experience, gay men have very strong objections to condoms, and literally, I have a job to do, and part of that job is maintaining my credibility, and that includes giving advice that can be followed. And for a lot of people for whom sex is a major event and a major activity, I'm not very likely to be able to intervene in how they behave sexually because it's a major part of their existence. And I would think twice before I sort of rush out with quick advice that may be superficially obvious. And I mean, your messages, get people to quieten down sexually, and I agree with that. Possibly I'm not as optimistic about you about how effective that advice would be.
Yeah, well, of course, I think that there's no question that the gay community, a very large percentage of it, has quietened down. They're being...
I think that's true, yeah.
But anybody who goes to some of the more, what I call sleazy gay venues will find that there are still those people who are prepared to take a risk with public anonymous sex, if you like to call it that. And I think that is, I think that's a great pity because it does endanger a lot of other people as far as this disease is concerned. There's one other thing, Basil, that worries me greatly, and that is some remarks that Terry made in relation to the blood transfusion service. Now, there was talk earlier in last month that Dr. Archer made a request that gay men who were promiscuous should, and bisexual men and their partners should not give blood donations.
Yeah.
Now, what worries me about that statement is I fully agree with Dr. Archer. I think that there is considerable reason to believe that blood is a way whereby the disease can get from infected persons to other persons. And I think that we should be cutting down every possible avenue whereby that can happen, because medical science can't do anything about the disease once you've got it. But common sense might help us to stop spreading it between individuals. Now,
I don't think Terry particularly objected to the advice. The objection I've come across was the way it was done, which was without consultation.
Give Terry a chance to defend himself here.
Well, I don't need to defend myself. It was the way it was done. But also Dr. Archer in his first statement did not say promiscuous homosexual and bisexual men. He said homosexuals. That was the objection. It was after consultation between and we objected not to the way the advice was done, and it wasn't done with consultation with the gay community. When the blood bank did consult with us, we agreed to the statement of promiscuous homosexual and bisexual men. So that I agree wholeheartely with that statement, and that's what we agreed with.
Thank you. That I consider that foolhardy. You have to realise that some gay men would consider themselves not promiscuous when in fact other people would. It's a value judgment.
That's true.
And there is another big problem that I feel is occurring from this, and that is that a non-promiscuous person, say a monogamous person, who may have on a holiday or some other occasion had one sexual contact out of his relationship perhaps a year ago, could still be a carrier of AIDS. And I think that is a potential danger. I think it's very wrong for us to let value judgments come into this type of thing as far as gay men are concerned.
But you've got to be a bit careful here. You're right in the sense that on any single sexual encounter you can wear anything up to 20. You can contract anything up to 20 different sexually transmitted diseases. But there are fortunately, there are, through the simple biology of it all, even if you are exposed to all 20 diseases, chances are you won't pick up all of them.
Thank goodness for that.
These things are always imperfectly transmitted, and really it's like life in general. It's a matter of probabilities. I mean, I'm constantly visited with this scenario. If I deal with a prostitute who's being quite blasé about the fact that she's working half in the knowledge that she's got gonorrhea, and I have visions of all the clients she's seeing who are going to massage parlours because their wife is pregnant, and God knows what he's taking home to the wife. But fortunately, the logical pathway of infection is usually broken by chance. So those things it just doesn't be. The impression you're trying to get across is that anyone who has had casual sex in the last year is a suspected AIDS carrier. And, that's true, but that's an awful lot of people.
Anyway, thank you very much for the points you've made. I'm afraid we'll have to take some more calls now. Good evening.
Hello. I'm so glad I made it.
Yes, I'm sorry, you've been waiting for a while.
Would a woman who has had NSU, had treatment for it, and been declared free, would she have any danger of it recurring, please?
Well, you're dealing with bacteria, and you're dealing with courses of medication, usually in the form of capsules. There is always a possibility of a treatment failure. There's always, I think...
It was antibiotics she had.
Yeah, but no antibiotic is 100% effective. You should...
Is there anything she can do?
Well, I think with all of the sexually transmitted diseases, even after an apparent cure, in this country it's usual, because of limited facilities, to only do one follow-up test.
That's all that she had.
Yeah, in England, where they're more fastidious about it, you don't get off the books until you've been through 3.
Well, would she go back then and have 2 more?
Well, I'd tend to think 3 usually isn't necessary, but maybe after another month or so, I think another checkup would be wise.
Oh, thank you. Because what harm can she come to through it?
What harm?
What will happen to her if
it's not treated properly?
Yes.
Well, I'm not exactly sure what you're talking about anyway.
NSU?
Well, it's difficult to diagnose that in a woman. If you mean she had a partner who came down with NSU, or whether she had an infection of the cervix of a non-specific variety, or what? I'm not exactly sure what you're talking about.
Non-specific variety of not of the cervix, of the vagina.
Of the vagina. Well, that's a different phenomenon again, called non-specific vaginitis, which is of nuisance value rather than being a serious illness.
Oh, so what she really should have determined is that she really did have it only of the vagina, not of the cervix.
That's a fair distinction, yes. Yeah.
But it may be worth her, and certainly it sounds as if you and maybe she is still very worried about it, and it doesn't do any harm to have another checkup.
Yes.
All right?
Thank you.
Thank you. Bye-bye. Good evening.
Oh, Bettina.
Yes.
Right. Listen, the caller before last made a couple of statements about blood transfusion and AIDS and blood donations, right?
Yes.
Now, what I wanted to do was quote from an article in the current issue of the Medical Journal of Australia by David Cooper, who is an assistant to Professor Penny, who's an associate professor of immunology at the St Vincent's Hospital in Sydney, and he says, and this is a direct quote, he says, avoidance of blood donation by high-risk groups is predicted to be ineffective and inappropriate. Now, the point of that, and that's a statement that comes out of a conference in New York, at New York University in March this year, which David Cooper attended. And the point of that is simply to say there's a lot of hysteria and a lot of nonsense being talked around this town about AIDS. There are a lot of people who seem to be interested in whipping up a bit of hysteria about it. if you read the current issue of the Medical Journal of Australia, the June 11 issue, the hard fact of the matter is that there is only one confirmed case of AIDS in Australia, and even then, not all of the aspects of that case fully satisfy what at least I understand to be the criteria for AIDS as established by CDC in America. Now, if people want to go off and be enthusiastic and rather dramatic and say, you know, blood donation, we've got to stop this and so on, I think we've got to say very simply, the evidence for that is not there. The hard fact is that the risk and the chance of the transmission of this disease, even if it is in this country, and we have to be very careful about saying that it is, because we really don't even know what it is, let alone what the criteria are for determining it. If it's here, and it may not be, then this whole hysteria about blood transfusion and various other things is at best rather dramatic.
Yes, I think you've basically summed up a lot of the points we were making or trying to make tonight. Terry wants to comment.
Yes, I'd just like to comment on the final thing is that when you talk about hysteria and panic, that it's become evident, especially from the medical journal article, that our medical profession is not immune to that sort of hysteria and panic. And I believe that in a lot of this incidences, they have been fueling the panic quite considerably.
Well, yes, I agree with that. I think the actual articles, with the exception of the leading article in the current MJA, are fairly cautious, frankly. The leading article, I think, is open to some comment of a negative sort. But the fact is that now that we have reported in the MJA, and with the exception of one other possible suspect case in the Communicable Diseases Intelligencer from Melbourne, we now have the hard data for Australia. What I think that the public at large ought to know is that a lot of what's been reported in the mass media, and I think sometimes fueled by medicos, including particularly fairly senior ones in public hospitals, who I think have been responsible for inspired leaks on this, is not consistent with the facts as we now know them. And it was about time that we got those facts. We now have them, and I think we can now sit down and look seriously at some of the rather dramatic stuff that's appeared in the press. And I don't think that a lot of the rather dramatic stuff that's appeared in the press and a lot of the rather dramatic response to that is justified in this country at this point in time. And I think we have to be very, very serious about saying that.
Can I give a sort of
Sure, Basil.
a partial excuse here for the medical profession? You know, as Terry intimated earlier, the funds haven't been rushing out of the public coffers with the pace that a lot of people believe. And I think sometimes doctors and journalists and editors of medical journals tend to build up issues and use words like epidemic in order to create enough public furore to get some funds.
It doesn't help, mate. Basil, it really doesn't help in dealing with an issue like this because it's...
Oh no, I know. I agree totally with you. I said it was a partial excuse. It's just a phenomenon. It's called medical politics, and the medical profession is as guilty of politics as any other profession.
I know about medical politics. What I'm also concerned about is frankly, and it's not a criticism of you, is in some cases sheer medical incompetence.
Yeah.
Where people are making statements which simply are not supported by the facts, and they ought to know those facts.
Yeah, I know what you mean. I've come across the phenomenon of late where a gay man, if he gets sick, the doctor stands at the end of the bed and calls him suspected AIDS.
Yeah.
And I think that is culpable.
When he simply wouldn't know even what the criteria are, even assuming that anybody does.
Anyway, you've made a very good point, and thank you for calling.
Thanks, Bettina.
Bye-bye. We'll have time for just one more call before we'll have to call it a night. Good evening.
Good evening. It's all been very interesting.
Oh, I'm glad to hear that. Some of these issues are so complicated and we really wonder whether anyone's following the points we're trying to make.
Terribly interesting, but mine's about herpes.
Yes.
I'm a little bit terribly confused. My daughter, who's only 14, has gets these cold sores on her lips. And she had a rather nasty one there about a month ago, and I took her into the pharmacist, and he said she had a herpes. Now, is that a type of cold sore? I mean, she doesn't kiss anyone, or...
She probably kisses her aunties and uncles and swaps pencils with other kids at school.
Probably do that too.
It's a universal little virus. It floats around families and schools, and most people have contracted it by the time they start at school.
Really? It's like a type of a cold sore.
That's all it is. Yes.
Goodness. And
when we used to talk about cold sores and treat them as insignificant and unimportant, that was quite the right attitude. It's just things have become very confused with genital herpes. And there are all these complications and that you can have genital herpes on the lips and so on, but basically cold sores really aren't worth worrying about.
Well, you know, I don't get them, and I've never had one. They say once you get them, you always get them. My older daughter gets them, but this little one, the pharmacist said herpes, and I kind of thought, when I've been listening to the program tonight, and they said something about a sexual... Maybe I'm ignorant, I don't...
Well, no, it is called herpes type 1, but there is a difference between that and the herpes that everyone worries about, which is the genital herpes. And even then, the genital herpes isn't nearly as much of a problem as everyone pretends it is. But that's the sort of simple answer, and we could talk for 3 days about the sort of real complications involved there. But I hope that reassures you a little bit. Maybe you should go and talk to your chemist about alarming people.
Yes, I will.
Okay. Well, thank you for your call. Terry, were there any other points you were going to make? We were talking earlier about some of the political issues, particularly with regard to the clinics.
Well, basically, one of the things that we as the gay community are asking for, or going to ask for, is for the reintroduction of contact tracing at the STD clinic, and this to be broadened to include AIDS. We're rather appalled to find out that there's very little contact tracing even of syphilis. And syphilis seems to be getting very low in everybody's opinion as a disease. I mean, one of the things I could say about the blood bank is that it does not do proper testing for syphilis. It only does it if you ask for it. Whereas I consider all blood should be tested for syphilis.
I'm afraid that's about it. There are a lot of issues we've raised tonight of things that should be being done that aren't being done, but I hope that increased public awareness may in fact cause some of the changes we've been discussing. Anyway, thank you both for joining me tonight. Next week I'll be discussing mainly books that people can read to help themselves with sexual problems and just to have a bit of fun bedtime reading. So I hope you'll be joining me.